Hi, I'm Tara Kirk. I'm a senior scholar at the Johns Hopkins Center for Health Security, and I'm also a assistant professor at Johns Hopkins Bloomberg School of Public Health in the Department of Environmental Health and Engineering. I also co-direct the Health Security PhD track in our department, which may be of interest to you if you're interested in getting a doctoral degree in this field. So I'm so excited to be here to talk to you about how I got to where I am in the field of health security, working on global catastrophic biological risk. It starts simple. I had a good connection with someone who was part of a network that got me um, my first job as an analyst at our center. But I guess I should back up a little bit. I was actually a professional athlete. I did not start off in this field. I swam professionally and was an Olympian and won a silver medal in the 2004 Olympics. But then when that was over, I wasn't quite sure what I wanted to do, but I knew that I was interested in biosecurity and bioterrorism. I had gotten a bachelor's degree in human biology and a master's degree in anthropological sciences, and was very interested in sort of the beginnings of health security before it was even health security. And so I was looking around to see what to do. And I, met someone who knew someone who was willing to hook me up with Tom Inglesby. At the time, it was the Center for Biosecurity. I started on the ground level as an analyst, and worked my way up from there. Got my doctoral degree while I was working at the center, and the center eventually became the Center for Health Security. And here we are working on global catastrophic biological risks during this massive pandemic, where our advice and all the work that we've done for the past 20 years, I've been in it for the past 10 years, has become really important in helping us figure out the policies and practices that we need to have to get out of this pandemic and move forward with our lives. Um, I think some of the things that are really important in getting there and getting here, and the lessons that I've learned are to, get in on the ground level, start, even if it's not what you originally expected to do, be willing to do that grunt work. When I came to the center and started in this field, I had been an Olympian at the top of my field, and here I was, cold calling legislators' offices to get their health staffers' contact info so we could send them invitations. I was counting paragraphs so we could reference things correctly. Sometimes you have to prove yourself, getting in the ground floor that you can do that work, and then you have the opportunities to move up gradually over time. Um, the other thing that I would have to say is really important is being ready for those opportunities. And sometimes you have to make your own opportunities. So that involves sort of thinking through when the moment is right, getting, starting new work when it's most needed, and having your ear to the ground on what is really important. I think it's also really important to be persistent. That's one of the lessons that I've learned coming from my swimming background, is that, sometimes you can have a hard time and it can be really tough. And you just need to keep on trying. Sometimes dealing with reviewers' comments or getting a grant rejected can be really demoralizing. And so I think it's really important to sort of know what you want and be willing to stick with it to get where you want to go. I think also one of the things the organizers had asked us to talk about is some of the projects that we've worked on. So when I came into the center, I worked on all ranges of things. So that was from, bioterrorism to nuclear consequence management, like what to do if an IND goes off in a city, how do we actually save the most lives? It is to let people know that they should shelter in place until they have an evacuation plan. I worked on things involving bioterrorism and understanding how these programs are funded in the federal government. Recently, I've been doing a lot of work with CDC on different policies. So like how different policies were made for quarantine and isolation during Ebola, how those differed all across the country and why they differed. It's really important because states, have the right to make up their own approaches. So we need to know what are the important factors there. I've also worked with CDC on resilience, trying to improve community resilience so that when these disasters happen, they're ready to bounce back from those disasters and recover effectively. And then I've also worked with CDC on communications, improving risk communication when we have to face these disasters, and doing a better job of getting the word out there to the public and helping them to adopt protective behaviors. I've also worked on a number of really interesting projects. These include crowd forecasting, trying to figure out or provide a platform for forecasters to determine the outcomes to different infectious disease outbreaks, to make a prediction on them and to see then how that can work in the field of public health. We were able to actually use the platform that we had created over the last year to ask our forecasters some questions about COVID-19 when it first emerged. And they said, and it has proven to be correct, that this was going to be a very explosive and fast-moving outbreak. I've also worked a lot in the last little while on understanding misinformation and disinformation and how to manage it, how to communicate effectively, but also address when people are getting false information, what are the things that we really need to do? I think I've heard from other scholars, one of the things that we as people who are understanding the science really need to do is engage with people. Don't mute your uncle, is what I've heard, and to engage respectfully with empathy and trying to have connection to help people understand the tactics that are being used in these misinformation and disinformation battles, and to help people verify and have new information sources. Now I'm working a lot on COVID-19. I helped, co-led the exercise that our center did in October of 2019 with a coronavirus, and looking at some of the things that we needed to manage. And from there, really, it's been moving into what do we do about this coronavirus? How do we manage some of these big policy decisions and deal with the unfolding events. It has not gone as we had hoped it would go, but I think there's always room for improvement. There always is room for us to do a better job, and in this case, it's certainly an opportunity there. And so as we go forward, I hope that my work will be able to help improve the response to COVID-19 and also prepare the US and the world for the next time we see one of these events. If it's a global catastrophic biological event, we should use COVID-19 to improve that response and learn from these mistakes and do a better job next time. I hope that you'll join me in this field. It's exciting. We need more young energy. We need people like you. And so I hope that you're inspired to join me in health security and preparing for these types of events. Thanks for listening.